Hey, how you doing? So I'm gonna do a quick little video on open gloving. The whole purpose of open gloving is to have sterile gloves on, and I feel like people mess that up really easily sometimes. So there's a couple of details that I'm gonna go over with, and hopefully you pay attention and practice it so you can do it right and keep it sterile. Here's a simple biogel glove that we use in the OR sometimes for prepping or for catheter Foleys. Now you do in the catheter Foley kits you do have gloves, but even though they're smaller, the packaging is similar. They do have similar type of folded edges that I will show you in a second. So hopefully you can translate it to that too. So here we're gonna go. I'm gonna show you again how I'm gonna do it, and as I go along the way, I'll show you the common mistakes that I have seen happened. Okay, so here we go. So first thing you do, open it. Okay, so the inside right here is obviously sterile, and I'm gonna try to keep it that way. And the best way I'm gonna do is try to use the edges right here to open it up without touching in the middle. So the first thing I do is undo the folds that are at the bottom. And notice I'm not going to grab from here. Again, I want to try to stay away from that middle. So it's going to be more on the edges right here. And as you see, I'm going to kind of almost fold it on itself like so it stays in place. And I feel like that's important. And sometimes it is kind of missed. Same thing at the top, just like I did at the bottom. Kind of fold it on itself, give it a little pinch so it stays in place. And then now that I have those two, I'm going to show you a common mistake that I think people do, and they grab it from in the middle. Of course, you can see the problem with that. Like I said, I'm trying to keep that middle part sterile. Try to grab the edges, like I said, from the edges. So I'm going to do that. I'm going to grab it. And very similarly, just like I did with the top and bottom, I'm going to kind of pinch it from here so it doesn't go anywhere. Okay? Pinch it. Try to kind of fold it on itself maybe. And you see I stayed right here on the edges, and I'm trying to stay away from the middle. Of course, like I said, if you grab from here, even if you manage to open it without touching the glove, the other problem I see happening is it flips back on itself. And then guess what? That's contaminated and that's not sterile anymore. So that's why I feel like even if you're not going to pinch it down here and you're in a hurry, try to grab it at least from the side so if it folds back on itself, it still stays sterile right here. That's really important, and I feel like it gets missed a lot. So, pinch it, kind of fold it on itself just like I did with the other side. And just like you see right here, it's not going to go anywhere. It's staying put. Well, obviously we have a little question in the corners right here, at the top, right there. It's kind of a little iffy, but the middle, where the gloves are sterile. Now the right glove, I put it on a little bit differently than my left, and you'll see why in a second. So another mistake. People like to grab the glove from this edge. You can't do that. That's sterile right here, okay? At least while you first put the first glove on, you can't do that. Where do you grab? At the bottom right here. And remember, as you pick up the glove, don't slide it. Remember, this down here is kind of questionable. When you pick it up, you want to lift it straight up. Now you can also see where exactly my hand is going to go. It's going to slide. Another temptation that I feel people have is that once they have the glove on, they try to pull on this, right? And if you grab here, again, it's questionable if you're going to keep it sterile. So just keep going with this edge right here and just let it go. And if you have a problem with it hanging right there like that, then just grab it a little more and just try to stay on the inside just in case it folds back on itself. Again, same thing on the other side. So with this one, you do not want to grab it here because your hand is going to touch your glove and you're contaminated. You want to grab it from here, okay? So that's why the right glove is a little bit different than the left. So now it's going to go in. And as you go in, just stay away from your arm as you put it, right? See how I'm doing that? Stay away and just let it go, okay? Once it's on, you're sterile and you're good to go. Guys, just practice it. Try to find the extra pair of sterile gloves out there, and Just practice is all it takes. Just remember those boundaries. Try not to touch the inside of the glove. Try to stay away from the middle. Keep it sterile.